My name is Fred Christian Jr. I am a 55-year-old disabled adult with several disabilities, which have impacted my healthcare journey, and I'm happy to be here to share my story today so no one has to go through what I went through. I live in Miami Gardens, Florida currently. I've lived in several places in Florida, namely Ocala, St. Petersburg, and Fort Lauderdale, Hollywood, North Lauderdale, born in Atlantic City, New Jersey. I live with my dad. My parents split up when I was 22. And my mom lives in New Jersey now. She's great. I got a great relationship with her. And my dad and I took care of my dad. I stayed with him, and he supported me even though I have learning disabilities and all kind of problems. He drove me every place. I was up the street at Coconut Creek Elementary, which is about 20 miles north in North Lauderdale, Florida in 77. That's when they diagnosed it. I had to do a lot of things with coordination, math, numbers, etc. I moved to Ocala in 81. Things started getting better. Lived outside Ocala until 92. Graduated Lakeport High School, Central Florida Community College. Things looked up. But unfortunately, my disabilities caught up with me because I could not drive a car. I had coordination issues. And even with a college degree, which I relocated to New Jersey to get at Rowan University in 1995, still my disabilities caught up with me because, let's face it, back when I was younger, people didn't know what they know now. People weren't as conscious as they were now. They weren't as aware. And I'm grateful that they are now for the children coming up. But I wish they were more aware of things then. I wish the healthcare situation had been better. But we're where we are now, and I'm an advocate, and I'm happy to help people. My journey with healthcare started in 1986, outside Ocala, Florida, and Bellevue, Florida. My dad, who I mentioned earlier, we had a volunteer fire department. We didn't have a lot of paramedics. It wasn't like Miami-Dade or Broward, where you have, in Ocala, the city up, where you had help, okay? I had one ambulance. And Dad knew I was having a problem breathing. He put me in the back of his Oldsmobile, Delta 88, not Delta 88, Cutlass Supreme, and drove me all the way to the hospital, which was 12 miles. Then I'm in the emergency room of Monroe Regional, which is now Advent Ocala. And I remember trying to be well at 16, and I'm scared. I don't know what's going on, and I can't breathe. And my dad, I'm hearing him with the admitting clerk, I'll pay you what I can pay you. I'm sorry. He has insurance, but I'll try to pay you. Please treat my son. Hearing your parent at 16 years old begging to save your life is something no one should experience. So we fast forward a little bit past that. I was diagnosed with asthma, allergies, and had to get allergy shots from a specialist. Specialist charged buku money. My insurance my dad had would not honor it because here's keyword, pre-existing condition. Back prior to 2012 with the ACA and Obamacare, they could get away with whatever they wanted to. And I was a victim of them getting away with whatever they wanted to. Lots of people, cancer patients, etc., were uninsurable. So I went from 1986 to 2020 without health care. I had to, a couple times I got sick. One time, that physician, I had to have relatives pay for my care, friends pay for my care. My dad paid for it, had to pay for medicine. It was not cheap. For asthma, had to buy an inhaler, still have to. Had to buy pills, and it was no picnic. The coverage gap is basically anyone that makes below $13,500 a month. Working people, disabled people, just anybody that's unlucky and struggling. That's what the coverage gap is. And it shouldn't be. It should not have been. This is our lives. We deserve dignity. We deserve to live our lives. We deserve to not go to an emergency room and beg. Or be in an ambulance and beg. Or have an $800 ambulance ride we can't pay. Or a $1,000 hospital bill we can't pay. Or half if we really need any kind of injury or any type of trauma, outpatient care, physical therapy, psychological care. This can help save a lot of people's lives and make people's lives better, create jobs, do a lot of good if they just would expand it. Haven't been to a dentist since 9 or 10 years old. The teeth are nasty. I know they're nasty. Hockey players got better teeth than me, I know. But you couldn't go. That was a luxury. Teeth fell out, though. Teeth fell out. Either bad food choices, medicine, whatever. Teeth did fall out. I lost filling, so. But, you know. You also had the housing issue, which is a choice. Do I pay my rent or do I have health care? That's a big choice. You know, right now our average rents in Dade are $3,000 plus a month for a one bedroom, $5,000 for 2 or 3 or a house. Who can afford that? Who? Making your average service worker at Publix, Winn-Dixie, Walmart, Burger King, McDonald's, maids, cooks. Who can pay that? We're going to lose a base of people that work here. We're going to lose the backbone, which is the workforce. So then you got the choice between healthcare and that. If people had healthcare, then maybe the mental health equivalent will be taken care of too.